Hi everyone. Today I'm going to talk about school health. This presentation can hopefully provide a structured and simple way for brainstorming and analyzing your school health and thereby helping you in working on improving it. It may be useful for all stakeholders involved in school health. These may be staff members working at the school, principals and decision makers, public health planners, and also students and their families as well. So, are you planning on improving your school health? But you're a little confused and you just don't know where to start? Let's try and move out of this gray area. This may actually be much more easier than what you thought. So relax, breathe, and let's start off by focusing on major school health components. These are 8 in number. Let's try and look at them one by one. The WHO recommendation of consuming at least 400 grams of vegetables and fruits per day came up with a 5 a day recommendation. Remember, don't eat the cat. Therefore, health education within your school, which is focusing on families and the students themselves, is pretty important. Do you have planned learning experiences providing an opportunity to acquire information and skills students need to make quality, healthy decisions within your schools? You need to cover health topics that are important, such as healthy nutrition, emotional and mental health, avoiding drug abuse and tobacco use, and also violence prevention. Another important component is physical education. Does your school offer students physical education facilities and encourage them to be physically active that maintain physically active lifestyles throughout their lives? Do you have qualified and certified teachers providing physical education activities within your premises? Another important component is health services. When students are injured, do you have first aid facilities or emergency care? Where do you refer them to if they need further care? What about chronic diseases for students and staff who suffer? What do you do about them? How are they cared for? What about healthy water supply and your food catering services within your school? You need to look at the nutritional services provided within your school and assess if they are healthy enough for both students and staff members. How about staff members within your school? They also need to have health promotion activities. Maybe they can be involved in physical education as well, or physical activities. How about students who are suffering from psychological problems or social problems? Do you provide support for those students? Is there any direct or indirect interventions addressing psychological, social, or even academic problems? How about your school environment? Is it a healthy school environment? Is it safe? Do students look out for each other if one of them isn't feeling great or is bullied? How about the physical environment within your school? Is your playground a safe place and a healthy place to be at? What about your classrooms? Are they well ventilated? Are the temperatures acceptable within your classroom? Are they comfortable for students and staff members working there? Last, families and parents should be also engaged in the process of school health. Communities are also important. Families can support students in their educational trip, and also they can be useful in supporting them in their development. The community can provide facilities through community-based organizations as well. So after looking at this presentation and the different components, you can start off by assessing each component within your school. After completing that task, you might want to look at or discuss with stakeholders involved in school health and find out whether they have useful and valuable suggestions to improve your school health.